I was making reservations. I was like, oh, I'm gonna make it for the 26th. Yeah. So just to be clear, you know what physical or
Sorry, I caught a message like earlier.
do you remember more? If I know.
Just gonna leave it at them.
Yeah, that's good.
Claire, do you know if council is going to be joining us?
I'll go check.
Okay, thank you.
In my home, I do not know, but I mean, since it can come today, I will get on schedule and send you. I should get.
Pat, are you doing a PowerPoint as well?
No.
Okay.
Smart show.
It's just,
Could you message him down for them that we're starting? There he is. Can we start the meeting without you?
No.
We weren't sure. Okay. All right. Are we ready?
no.
We're good.
We're good?
Start
Oh, yeah,
I'll
yeah,
just
sure.
start standing by for the. We're ready. I have this sense about when things will be ready. So.
Uh-huh. Let me know when we're live. We're live? Are we recording? Oh, okay. Good afternoon. Welcome to this meeting of the Health and Welfare Committee. My name is Tina Sablan. I am the chair of the committee. Committee members present today are Representative Staffler, Vice Chair Representative Leila Staffler, Representative Sheila Babalta, Representative Donald Maglonia. Representative BJ Attal is excused. With 4 members present, we do have a quorum. Council Joe Tyron and Legislative Assistant Claire Sablan are staffing this meeting today. And with that, members, is there a motion to adopt our agenda?
Adopt our agenda.
Second. Motion has been made and seconded. All in favor of adopting the agenda, please say aye.
Aye.
All opposed, say nay. Motion carries. The agenda is adopted. Today is February 26, 2021, and it is 1:37 p.m. This time, members, next in our meeting agenda is there a motion to adopt the meeting minutes of January 29th, 2021?
So moved.
The motion has been made and seconded. All in favor of the motion to adopt the meeting minutes of our January 29th meeting, please say aye.
Aye.
All opposed, say nay. Motion carries. The meeting minutes are adopted. Today, colleagues, and for members of the viewing public, we have invited Mr. Warren Villagomez, the chairman of the COVID-19 task force, and the governor's authorized representative to FEMA, Mr. Patrick Guerrero, to provide briefings on the Commonwealth's COVID-19 response. Welcome, gentlemen. If you could, please introduce the members of your team who are here.
Thank you, Chairwoman Sablan, Representative Babota, Representative Stafford, Representative Munonia, and the LB staff. Here with me this afternoon is Kevin Bautista, the task force, and the governor's press secretary, as well as our staff, Ms. Farah Yunus, under the COVID-19 task force. And in the audience, of course, my CEO Munya, and Chief Operating Officer Sort of Energy. Thank you.
Thank you, Mr. Villagomez. Welcome, CEO Munya. Welcome, Mr. Banerjee, Ms. Yunus, Mr. Bautista. And Mr. Guerrero, did you have anybody that you wanted to introduce? It's okay. Your one-man show. All right. Thank you. So we can move forward with the presentations. If you could both, gentlemen, begin by describing your respective roles and provide an overview of the Commonwealth's response since March of 2020. Please limit your presentations to 10 minutes or less. Longer testimonies can be submitted for the record. Then Mr. Villagomez, we'll start with you since you do have a PowerPoint for today, and then we'll hear from Mr. Guerrero. And members, if you could please hold your questions until the end of both presentations. Thank you. Mr. Villagomez, please proceed.
Thank you, Rep. Sablan. Thank you for having us this afternoon to provide an update on what is we've been tackling on since early 2020, and providing the most recent update of developments and improvements and infrastructure enhancement build up as far as the current state of vaccination that we are in 2021. We have my team and I and the governor's authorized rep had gathered the information that you have indicated on your letter to us for this afternoon, and we hope that we will be able to cover all the details as what is going to be up on the presentation, but inquiries as well as more needed information can be asked, and we will work on those details. So what we have up on the screen on behalf of the COVID-19 Governors and Task Force, we've been battling the unknown for over a year, and early on in the year 2020 or even 2019, there were a lot of things going on in the region, dengue, measles, and other interesting infectious diseases that we are monitoring here in the CNMI under the Emergency Preparedness Program under the CEO's office. So with that said, the China phenomena was popping up, and it was very interesting early on and scary. So with that, there were a lot of planning discussions made with the CEO, myself, and her team, as well as the governor. Early reach out to CDC, HHS, as well as within the CACC team, made and brought us to where we at now with a lot of the success that we're seeing because of early planning and a holistic government approach. So I'm going to go on with the presentation. As what the governor stated early on in the pandemic, is we are a community that is very vulnerable to COVID-19. We must do everything we can to protect everyone from this unknown virus. This statement was made late February as things were brewing, evolving in China, and early on we were anticipating air traffic, transportation shortfall in regards to the issues and the infection that's happening in China, because of the market that we have in tourism here in the CNMI is dependent on Chinese visitors. So we gathered all the team within the government, MVA, CACC, CNMI Customs, the Governor's Office, basically CPA, the two municipalities, and of course CACC, to make them aware of the situation that we potentially need to prepare on. And we were able to successfully meet at a World Resort with the lead of Dr. Tadella and CEO Munya to provide most current update. And there were a lot of unknowns early on of that phase of the response. Next slide, please. A whole government approach since January 2020. Of course, the administration, CEO Munya, CNMI's efforts to protect the health and safety of CNMI residents from the spread of COVID-19 outbreak through increased health screening, establishing quarantine protocols, cost containment measures to stabilize government services. Next slide, please. This is where the holistic government approach, cohesive collective meeting that was done at the governor's office. As you see on the presentation, the governor's office, MVA, of course CACC, Department of Labor, CODA is a big part of this, as well as NMC and PSS to alert them and provide the most current updates and plans on next steps. So CNMI's response to COVID-19, January, CACC Agency Operations Center was activated on January 30. CACC began messaging about steps to take to reduce the transmission of viruses not much known about the SARS-CoV-2 virus. CNMI was the first U.S. state territory to locally take proactive action and preventative measures against the novel coronavirus, now known as COVID-19. Health screening at CNMI ports of entry began. Again, Executive Order 2001, declaring state of emergency, ordered CAC to implement preventative measures. I guess I'm going on. Next slide. So we are at CNMI's response to COVID-19. February 2020, CAC sent its first specimen for COVID-19 testing. Specimens had to be sent to CDC in Atlanta it took about 10 days to receive the negative results of that particular test. CAC began conducting formal surveillance at Saipan International Airport, screening visitors to the CAC through health declaration forms. So before we actually build on an infrastructure digitizing the entry declaration, early 2019, I had proposed to MBA to implement health declaration forms separate from the CNMI custom forms. We didn't have that, and with that idea, it actually enhanced the thought on making it electronic and getting everyone pre-registered. So in the event that we need to go back and do retroactive contact tracing, we are able to electronically and type and have a timely investigation done. So the governor issued Executive Order 2002, continuing ongoing preventative measures. Loss of China market negatively impacts CNMI economy and government revenue. Next slide, please. CNMI response to COVID-19 in March. COVID-19 task force begins formal planning as COVID-19 spreads all over the world. Guam confirms the first three cases of COVID-19 on March 15, 2020. Governor Torres and Lieutenant Governor Palacios ordered the shutdown of all government offices and all non-essential government functions. All non-essential employees of the Commonwealth Department and agencies are asked to stay home until further notice. PSS and NMC cancel classes, MVA cancel major events for unforeseeable future. Next slide, please. CNMI response to COVID-19 and continuing on in March. CACC announced its public guidance for COVID-19. Again, thank you to CACC and its infection team to be and able to provide full details and campaign in regards to preventative measures. Stay at home, stop the spread, as well as guidance regarding social distancing and proper hygiene. Mandatory quarantine for all travelers implemented. CNMI confirms first 2 cases of COVID-19 in March 28, 2020. Businesses begin reduced hours of operation in line with social distancing and other preventative measures. As the request of Governor, United Airlines has agreed to suspend all flights into and out of CNMI from Guam, April 6 to the 30th, 2020. Next slide, please. In April, President Trump approves the administration's request for major disaster declaration for CNMI. CARES Act implementation and planning began. Governor's COVID-19 task force puts plan in motion, increasing medical capacity at CECC through building of the medical care and treatment site, MCATs, currently the vaccination site for CNMI, and the alternate care site, ACS, at Kanoa. CNMI acquired 60,000 COVID-19 test kits from Sojet in South Korea. FDA approved as of May. EUA, emergency use authorization of May, approved as of May. CNMI begins community-based testing at Saipan International Airport. In May, CNMI community-focused economic recovery plan is unveiled. This new policy outlines phased approach to reopening economic activities in the CNMI, developing guidance to protect businesses and customers, and ensuring compliance with public health directives intended to safeguard all residents in the Marianas. COVID-19 task force continues to work on acquiring PPEs for first responders, community members, and expansion of medical capacity should cases spike up. CNMI at community vulnerability level yellow at this month of the year 2020. So there's a lot of projections that were coming in from HHS, CDC. At that point, FEMA even came up with a projection of 8,500 infection here in the CNMI. Next slide, please. CNMI response to COVID-19 in June. CNMI COVID task force continues to work on expanding CCC medical capacity and addressing needs. CNMI now at community vulnerability level blue. New quarantine procedures allows for responsible exemption from quarantine. CNMI response to COVID-19 early July. COVID-19 task force and CCC successfully secures funding to expand CCC medical capacity and addressing needs. CNMI continues to monitor spikes in cases in Guam and in the U.S. mainland. Adapts quarantine procedures for all U.S. travelers. CNMI continues to be responsible. CNMI continues to responsibly transition for reopening of tourism market in order to address economic needs. Next slide, please. CNMI response to COVID-19 in August, adjustment of curfew hours from 2 a.m. to 4 p.m. Adjustment of business hours, 5 a.m. to 1 a.m. Full reopening of public beaches and pathways for all recreational activities, including social gatherings. Due to the identification of community transmission, temporary restrictions were imposed August 24, 2020 through September 6, 2020. Returning CNMI to community vulnerability level yellow. Curfew hours changed from 10 p.m. to 4 a.m. Social gatherings limited to 10 people. Church services limited to 50%. Businesses limited to public operation between 4 a.m. to 9 p.m. and 50% occupancy. Restaurants were limited to 50% occupancy. And this is in August. Next slide, please. CNMI's response to COVID-19 in September. Temporary restrictions lifted. CNMI returns to community vulnerability level blue. Curfew hours changed 2 a.m. to 4 a.m. Gatherings allowed to increase. Church services return to 75% occupancy. Businesses return opening to 5 a.m. to 1 a.m. for public. The public at 75%. So restaurants and bars return at 75% occupancy. So with that said, there's, you're hearing 75% and 50%. as we continue on to gauge and do daily assessments with the consultation of CEO Munya, we were making adjustments to accommodate needs within our community, but at the same time, as the water bulb terminology is used, as well as the dimmer light, as we see the vulnerability threat level goes up, we have to make adjustments and bring more safety measures for our people. Next slide, please. CNMI response to COVID-19 in October, official turnover of alternate care site to CAC. ACS was recommended by CDC FEMA during the initial planning stages of COVID-19 response to help mitigate against potential increase in hospitalization. Next slide, please. CNMI response to COVID-19 in November and December 2020. CNMI election planning were being discussed throughout CNMI. Added COVID-19 mitigation measures, COVID-19 task force, in close collaboration with the Commonwealth Election Commission, planning and preparation between CACC and the Governor's COVID-19 task force on CNMI's vaccination rollout, vaccinate CNMI as a public campaign, collaboration between public and private healthcare partners on vaccine rollout, including public health education, outreach, and others. Vaccination began in December. Next slide, please. CNMI response to COVID-19. This data that we have is as of yesterday, if not mistaken. 2021 vaccination rollout, total vaccination numbers, and CEO, please correct me if I'm wrong. Dose 1, 10,375, and dose 2 is 7,441. Total vaccination completed, 17,816. So phase 1A covers healthcare workers, first responders, Manamco, age 60 and older. Phase 1B covers government employees within the executive branch and autonomous agencies, as well as eligible community members as prescribed by CACC. Next slide, please. 2021 vaccination rollout continues. Phase 1A, 9,259. Phase 1B, 8,557. Breakdown by islands, 16,000 for Saipan, 613, Tinian, 510, and Rhoda, 693. Those 2 completed by categories. Manamco, 8,146, CACC staff, 680, private clinics, 216, total healthcare workers, 898, COVID-19 task force first responders, 593, government employees, 1,236. Other highlights, mobilization of MCATs to house and support the vaccination rollout. Task force coordination, collaboration with Department of Defense through the Office of the Governor, mobilization of resources and assets throughout the response to Rhoda and Tinian, providing PPEs and other infrastructure support. In Tinian, we were able to erect 4 Alaskan tents to accommodate the vaccination efforts. That includes air conditioning, computers, hardwares in Rhoda were also supported, as well as chairs and tables, as well as sending down our call center staff to train them and assist them early on of the vaccination rollout. So coordination with CCC and the task force has been seamless on all levels. So elevated border watch in Rhoda. I know this is a big topic, in regards to the Guam-Rhoda traffic, Rhoda-Guam traffic. We are very proactive on the Rhoda border because of the Guam proximity, and Guam's vulnerability level is still very concerning to us. And with the population in Rhoda and the capability that we have in Rhoda is very limited. We don't want we as a team decided to continue on all the protective measures and enforcement. And yes, there's so many inconvenience and concerns in the community about commerce and food security and many other things. But at the same time, the value of human lives is nothing more but making sure that we save them. So alternate care site resources as well that we have at at the current Canoa site are being coordinated and utilized with CACC at the current moment. So there are beds in there that are over at CACC supporting the needs. Dialysis machines are being tested as well on whether there's enhancement and improvements that could be made at CACC facilities. So as we continue on responding to COVID-19, we want to share that all efforts on a daily basis are seamless with CEO Munia and her team, as well as the COVID-19, from the governor's office to DFEMS, DPS, CODA, DCCA, CPA. We're tightly engaged on updates, as well as the governor's authorized representative, making sure and ensuring that all expenditures are within the allowable limits of FEMA reimbursement. Thank you, Chairwoman Suna and team and members of the legislature.
Thank you very much for that presentation, Mr. Villagomez. Mr. Guerrero, you may proceed.
I was going to interrupt 9 minutes ago when said he was eating into my time. But so thank you, Chairman. He covered a lot of what I would have just pointed out or stressed in all the information he provided. But pleasure again to be here. Chairwoman Sablan, Vice Chair Stafford, and other members of the committee to answer and give you guys an update and overview. So maybe I'll go straight into my role, and then we can take questions. Again, thank you, Chairman, for that comprehensive overview. So if you don't already know, the governor's authorized representative, my name is Patrick Guerrero, and in this position, it's really it's a link to the CNMI government, between the CNMI government and FEMA. It's a title used under FEMA's program during major disaster declarations. So whenever there's a declaration, as Chairman Warren pointed out, that was declared on April 1st, the governor appointed myself, I was maybe not appointed, put me in this, gave me the title to communicate with FEMA. And FEMA then was the lead agency to assist at the national level, HHS and other federal agencies. So at the local level, the position or the job became that much more important to coordinate CNMI government support for public health. We are, or I myself, advise the Homeland Security and Emergency Management Office, Special Assistant General, in the needs that come up or the requests that come up from CHCC. But at the end of the day, it's we take kind of requests from CEO Munia on what's needed to address this public health emergency. Update on, to add to Chairman Villagomez's presentation, just to give you guys an update. What we're doing right now with the vaccination is another line of defense to what we've been doing since March of last year in our quarantining or in the community-based testing that we did for a few months. That I'm sure you know has has been put on hold, but we continue to quarantine incoming travelers since July of last year. We have not changed much, if any, of our protocols that we have put in place. It's a system that works. To date, we have quarantined 7,050 individuals, returning residents, some who have to travel for whatever reason and return. We also quarantine non-residents who qualify for under the program. If not, then we charge them. Essential workers, mostly we're seeing is the non-residents that are traveling into the state of Mai. We quarantine them as well. And of course, positive cases and persons under investigation. So in the beginning, as you know, we used PIC, and as of today, we still continue to use Kanoa and the former Marianas Resort. Chairwoman had sent out some questions, and I think some of them were answered in Chairman Warren's presentation. I think there's a few that are still left out there to be answered. I think I'll pass it now to you if you want to fill in the blanks here and there. So thank you again for having us here for that update.
Thank you, Mr. Guerrero. This time members, we can open the floor for questions. Rep. McGuire.
Thank you, Chairwoman, and good afternoon, Chairwoman Villalobos, Press Secretary Bautista, and Mr. Guerrero. Thank you for coming here and sharing some of your work with us. The questions that I have, I guess, relate to the whole procedures in terms of quarantining and traveling into the cinema. So can you briefly go over what are the processes for these travelers once they land on Saipan? What do they have to go through at the airport, and what's the expected time before they get bussed over to a facility?
Yeah, thank you, Rep. Mangonia. And CEO Munia is here as well, and she can, elaborate on my details that I'll be presenting. But I want to share on early on of this response, we had implemented measures at the airport at a higher level, fuller level of basically screening, requiring passengers to pre-register before they board the aircraft coming here with questions and details that are being asked. So we as well implemented on-site personnel to support our island community that are not accessible to Wi-Fi or wireless devices outside CNMI. So that process was implemented early on. They get entertained, verified, making sure that all the details that we are requiring at that particular time are met, and if not, we assisted them. So they go through a flow upon entry, and after the screening, they get swabbed. They get sent over to the custom area far east of the arrival area, get swabbed, and after that they go out and go out to the baggage area, pick up their baggage, go to the custom inspection site, gets secondary verification that they went through registration, verification, as well as swabbing, and then they get inspected. They get ushered out to the buses. So it is a lengthy process throughout all those times that we had implemented the airport swabbing process and screening. So later on, about 3 months ago, and CEO Munya can correct me in this, we shifted down the process of swabbing. We're still doing verification and assisting registration at the airport with defense support as well as Homeland Security. Sometimes assistance needed because of issues, hiccups. CACC steps comes in and gives us the support. So the process now is a lot quicker because we verify, register them if they haven't registered. Pretty much everything's electronic. They pick up their baggage, get on the bus, ushered in the bus, making sure that no one slips out from riding the bus, goes down to the respective government quarantine site, which is the two sites are Canoa and Mariners Resort. They get to the site, get checked in, and then they go through the swabbing, and that will be the first day testing, quarantine for 5 days, and then they get their 5th day swab, and hoping that they're not negative on the first, as well as not negative on the 5th day, but positive.
Well, the question or the reason I asked the question is because several passengers, at least the ones transiting the Rota, has expressed their frustration in terms of the process. And I understand that you've tried to streamline the process, but something that could reduce the time spent at the airport. I mean, is this something that passengers can fill out a form while in the air or prior to coming into the Saipan, and then that way once they land, all they have to do is submit the form and send them on their way. But I think I don't know if that's happening, and if it is, it's a recommendation maybe. And I guess the question that you did not answer in my first question was, what's the average time spent going through that whole process?
It's about if you register, it's easy because you can register. It's about maybe 10 minutes. Now that we're not swabbing at the airport, just to go verify. Depends on the queue too, and how much resources we have out there. So there's a lot of concerns that we are mindful on. Infection control and making sure that steady flow is going on. But it's we've been promoting. We're doing this for about a year now. Pre-registration is encouraged. So CNMA have official registration site. We just we continue on to campaign and make sure that our communities are aware of the service that could limit wait at the airport.
Rep Mongolia, just to add quickly to that point by Chairman Gomez, the task force in CHC has had a process in place where residents who are traveling into the CNMI could pre-register through the travel form provided on the governor's website, which has been the web form being used throughout the entire response. That digital service was an important component, both with regards to social distancing, but at the same time too also to ensure that the queue wouldn't be too long of the wait at the airport. The focus for the task force and for CHCC was to ensure that the process was smooth for especially returning residents, because there was a large influx of returning residents who were coming from the continental United States and Hawaii, coming back home because they were seeing that because cases were being spiked up in those hot areas around the states, they were coming back home because they were seeing that success and the measures being implemented were conducive enough for them to come back, especially within the context of the pandemic. Thank you for that question.
Thank you. Chairwoman, if I may continue?
Yes, you still have the floor.
Thank you. Additionally, you mentioned that all these inconveniences. So do you offer, at least to the transiting passengers trying to get over to Tinian or maybe Rota, the opportunity to extend their stay after they've been cleared the second time, pending a confirmation of a flight to Rota? Because a lot of the how to say this, transient passengers would have to wait until they know when they'll get the results back. And sometimes by the time their second result comes back, the flights are booked. And so do you provide that courtesy of allowing them to stay until they can book a flight back to Rhode?
Yes, Rep. Maglonia, we do. And I do get occasionally calls and, for what maybe whatever reason it is, the communication didn't get to our front desk, but we are allowing the Rhoda and Tinian residents that we assist them, especially when the test results comes at a later afternoon and, flights are all done for the day. And, yeah. So we're trying to do our best in identifying who is a Rhoda resident, Tinian resident, to make sure that we avail that accommodation.
Okay, thank you. And just one more for now. In terms of those that have been vaccinated, are there any plans to change the quarantine procedures, or it's still going to stand at the 5 to 6 days?
Right now, it's still unclear. There's a lot of discussion going on with CEO Munya, CDC, on that particular question. And we will get back to everyone and the entire community, informing them of what will be next steps. But as of this moment, the safety measures is still that we quarantine people. So there's a lot of discussions going on different options, but it needs to be confirmed.
And just to quickly add to that.
Actually, sorry, Mr. Bautista, if I could cut you off real quick. Colleagues, if you have no objections, I'd like to invite CEO Munya, since she is in the gallery, and Chairman Villagomez has said that she could also possibly add to our questions, or add to the information that he's sharing. So Ms. Munya, you're more than welcome to join us. And if you, with your special advisor, Mr. Banerjee, sure. Thank you, and welcome, Ms. Munya, welcome, Mr. Banerjee. And I think, actually, Representative Maglonia, you still have the floor.
Well, Mr. Bautista was going to respond, add on.
It's add-on, okay. Please proceed.
Thank you, Madam Chairman. Chairwoman, so just to quickly answer your point, because I know exactly what you're getting at in terms of the adjustment to quarantine. Just from both the governor's office perspective as well as the task force and the conversations with CHC, that evolving discussion of adjusting the quarantine protocol, we're also cognizant of a lot of the adjustments to quarantine in the other island, our peer island communities, Guam, Hawaii, that are taking steps because of the vaccination rates that they're having in terms of the reopening of their economy. So I know that we just had a discussion this morning about that the Governor's Economic Council advisors have dutifully provided for you. A lot of that discussion as well, in line with that economic reopening plan, also is in touch with the adjustment of quarantine, which again is an evolving discussion between Commonwealth Healthcare Corporation, the task force, and the governor, to make sure that we do this in the right way, and to ensure that the success that we've had within the community continues to be built upon and continues to be done so in a transparent and safe way.
All right, thank you, Mr. Bautista and Chairman Villagomez. Are you for now, Chairman?
Thank you, Representative Maglonia. And Ms. Munya, did you have anything to add to these questions regarding quarantine and protocols?
Thank you, Madam Chair. Just want to add that we do try to accommodate. We understand if we have a system in place where any occupant of the quarantine site can make a request. Let's say they have a flight that needs to get out by on the 5th day. We make arrangements to try to test them as quickly with a faster platform, so that they can get the results in time for their flight. And the task force has been really, really helpful to try to even get that to their airport as quickly as possible.
Thank you. Representative Moffitt, did you have a question?
Thank you, Chairwoman. Thank you all for being here with us today. And thank you for your efforts in keeping our community safe. It seems like now local agencies, nonprofit organizations, and other groups must contact the COVID-19 task force if any kind of gathering were to happen at the multipurpose center, schools, etc. And during this time, with comment periods being open to our community when federal and local plans are being introduced, it is very important that we have our communities gather at the public hearing, public meeting kind of venues to receive this data and community input, right? So can you just please talk about the process of these groups, whether they be NGOs, government agencies? What does the process look like when they need to host a public hearing or a public meeting or a community forum? What does the application process look like? And is this a requirement? And are there penalties assessed?
So it's a question for Mr. Villalobos? Yes. Thank you, Mr. Villalobos. Please proceed.
Thank you, Rep. Babolta. Yes, we've been getting a lot of requests for different events, from sports events to meetings and so forth. So I actually just thought of this today, how to streamline and effectively accommodate each and everyone's requests. Usually they call the call center or the semi 287, or it says the hotline for, what do you call that? Yeah, the number for that hotline, it's out advertised, and we that's where the government request or NGO request goes through, and they pretty much submit in a request of intention on the particular type of events that they're gathering. We have a sub task force that's head by ABTC, Defense and DPS, that goes out and do an assessment, as well as the the school reopening task force. They help each other, environmental health, DPW, and defense. So we're trying to accommodate everyone's requests in regards to the 3 Ws, wearing your mask, social distancing, and making sure that you have hand washed and sanitized. But at the same time, events are also building up as we speak. A lot of interest. There's a lot of questions and inquiries coming in. Are we on level green? No, we're not on level green yet. People are misunderstanding those events, that it's just an open event, but we actually go through guidelines and making sure we do site inspections with them to provide them proper setup and proper social distancing advices.
Okay, thank you. So since there is an enforcement team at many levels, are there penalties assessed or any kind of fines or anything like that?
There is a penalty, and we're waiting for the AG's office. The Attorney General had assigned an assistant AG to fine tune the penalty, but under 1363 on this declaration, and CEO Munya can elaborate more. It gives the enforcement and CEO Munya as a CNMI health official the authority to either shut down, enforce, or come up with proper enforcement measures. Thank you.
Okay, thank you. And so far, has anyone been fined or any fees assessed?
No fines have been assessed, but we've done closures on restaurants that are not complying. So there are no fines as of what I understand.
Okay, thank you, Chairman. My next question is, how is the task force measuring community compliance? And is there any enforcement in that area, since now our community is beginning to gather at the home, in the private, in their private property, at the beaches too. And so, if we're going to be setting standards in the public spaces, then are there any concerns in the private spaces?
Yes, thank you for that. About 3 days ago, I met with Commissioner Guerrero at DPS as well as Defense on a lot of early stage discussions of this pandemic in regards to groceries and home barbecues and so forth. It's been escalating. There's concerns in the community that are coming in to DPS 911. So yes, we are doing more, we are trying to be vigilant and doing more village site, roadway inquiry in regards to gatherings. We're asking people when we drop into their residence to adhere to the 3 Ws, wearing the mask and social distancing. But again, all efforts are being coordinated. Thank you. And this is for Rhoda and Tinian as well.
Okay, thank you. I think I just want to express some of the concerns coming from community members who feel that if there is a lack of consistency, then that needs to be addressed overall, or just make some amendments to, these requirements that we set in the public space but not in the private space. There's enforcement in the public space but not in the private spaces. So just some of the inconsistencies that are out there and just being addressed and brought to your attention. Then my last question is in regards to the Marianas Resort location, because we were informed by the Secretary of DPL that the final two interested parties for the contract that Marianas Resort has given their presentation to the department. And so what are the plans looking like in regards to the transition when that property is going to be awarded or contracts announced? This would be for Mr. Guerrero. Thank you, and that would be my last question.
We haven't been evicted yet, but so we're continuing to use it. We do know that that date is closing in. I've had meetings with DPL as well in the last couple of weeks, and the most recent one was that they may, provide like an intent to award to one of those two in the next couple of weeks. Of course, it comes then to this body to approve of that new lease. Currently, is being operated by one company. Well, I don't want to say further, but if an intent award is released and the winning bidder or the one that the government DPL is intending to award wants us out because they want the property as is, then we have to look for other venues. Right now, our numbers are well, we got an extra flight coming in this next week from Guam that has another flight. So we're hoping that we could still occupy it. If not, then we most likely have to look at another property to add. Kanoa is, I've looked at the numbers and we can accommodate the numbers that are coming in, and I'm assuming only this extra flight might just spread out the number of people that are coming in, just gives them another day, another option. I don't see too many people coming in. Spoke to United also just to get a forecast, and they said they were adding the flight because they had more outbounds or requests for outbound travelers. But if it does, then we either need to go to another property or hope that Kanoa, the number of rooms there are enough for these flights. So we're prepared to look for other properties if needed.
Thank you. And in that transition or move, what will happen to the investments made in the property? And has an assessment already been made on how much we're going to lose because of the transition?
Sorry, can you maybe elaborate a little bit more on that? I think I know where you're going, but just...
Yeah, just if any investments were made in the property because of COVID, right, and it being used as a quarantine site, and now having to move properties, of course, there will be some kind of loss because of all that's already been invested in this one property, now having to move if we need to open a site on a new property. So my question is there an assessment?
We know what we put in to get it ready to operate as a quarantine site. Luckily, we used some federal grants that came through OIA. Very minimal though, air conditioners here and there. In fact, we've probably done them a favor in keeping at least the landscape what it is, so it's not worse than what it was when these investors went for site visits. Very minimal. How detail recovers that? Not sure if they're incorporating that into the new appraised value of the property. I don't think it's a significant amount, to be quite honest. Maybe that's a question for DPL more than for us.
Yes.
Thank you.
Thank you. Thank you, Mr. D'Alembro, and thank you for investing in and maintaining the site and preparing it for our new investors. Thank you, Chairwoman Ayo.
Thank you, Representative Babasa. Since we are the subject of contracts, Mr. Guerrero, we did submit to you and to Mr. Gomez a list of questions that came from the committee members, and perhaps you could just run through those. So on COVID-19 contracts and funding, do you have an updated listing of contracts?
I apologize, Chairwoman and Committee, not today, but I was going to request, I get a monthly, updated monthly report from Homeland Security. It's really their main responsibility, but seeing as this is the end of the month, I can provide something to you early next week.
Okay.
If that's okay.
Sure.
I do have general numbers if you want, to share. We were here a couple months ago, but.
Right, and you did mention that amounts had been de-obligated or would soon be de-obligated, so I think we were interested in getting an update.
Okay, so let me, give me 1 second. To date, these are our numbers. We have a running balance of 81.9 million in emergency contracts. Our what we call force account labor, our cost of salaries and benefits, 3.4 million. So that's a total of 85.3 million that we've that's in the system. The adjustments, there's no adjustments to be made on the labor side, of course, but on the emergency contracts, we're looking to make the obligations in the amount of 24.7 million. We've received, and I can put this in a summary to attach to that list of contracts next week, but to date, we've received 25.1 million from FEMA. 38.7 is currently under review with FEMA. We are estimating that we might not recover about $8 million just because of the nature of the FEMA program. We supported community-based testing that's not yet an eligible activity. The new Biden administration is coming out with some new guidance in the coming weeks, and early information is to make some previously ineligible activities become covered. So great for us if they're able then to cover community-based testing, some of the support we've provided in contact tracing to CHCC, and some other activities that as of today are not eligible, but we hope that they are. That coupled with the increase in federal share up to 100% is, well, that alone is already sort of a victory for us to not have to come up with the 25% cost share. In relation to a short 6-month response event in U2, I think we're doing great after a year. honestly, and the decisions we're making, and knowing that we're not going to recover every dollar, but the success that we have today and the low numbers of cases can't put a dollar amount or price to that. So that's just an overview, and I can put that in a summary along with the list of contracts. But in the last couple of months alone, it's mostly to gear up for this vaccination. We were already happy a month ago because actually vaccination was already granted at 100%. So we knew that what we were doing for the last 2 months was going to be covered. But now to go back to January of last year and cover everything at 100 is all good news for us.
Thank you, Mr. Guerrero. And the next question was, how does the task force, perhaps this is for Mr. Gomez as well, how does the task force identify priorities for the distribution of funds? How are decisions made exactly on where to spend and how to allocate resources? And would you just clarify who is the expenditure authority for task force initiatives?
Okay. I know Chairman would want to say something on this, but if I may start. The task force and the whole structure of this response is to really link the health side and the government side to be that conduit. And of course, I always think back at what better person than Chairman Gomez, because he has been emergency preparedness at CHCC for many years. But at the end of the day, it's a request coming from health, from public health to the government. They do a lot of things on their own. The health department or the health official does through CHCC. But wherever they feel that they need the state support, we step in, and by law, that's Homeland Security. Its main role is to have what we call a unified coordination group. So at the end of the day, the Special Assistant for Homeland Security is the expenditure authority for the response. I get involved in advising so as to be the most in line with FEMA's public assistance program, so we can benefit as much as we can by getting reimbursements. So reimbursements are, well, when they come in, they're just to reimburse for dollars spent. So it's not really for allocating to other activities. In a disaster, I mean, we're always in a tight financial situation. So but in a disaster, I guess, it's an emergency measure that needs to be done. Of course, the Secretary of Finance always has to be in the loop on what's going to be coming to him in terms of dollar amounts, and it's on him now to say at some point we can't do this anymore, or we don't have financial means to do it. We did receive in this event a lot of CARES Act funding. I don't oversee it, nor the task force, but we can make requests to the Secretary of Finance, who was the expenditure authority for that. And in some cases, I believe he funded some activities through that funding. Don't know where at the end of the day he got a lot of the funds that we needed to do the activities that we carried out, but we're here today, and we do still and we're still trying to keep within our reasonable time to pay some of these vendors that we still owe some funds. But as we get more reimbursements in, we're sort of keeping afloat, so to speak.
Mr. Bill Gomez, did you want to add to that?
Yes, yes, thank you, Chairwoman Sablan. As I was thinking on and just listening on what Gar had stated. The question is, expenditure authority, who, at what level of work authorization does the task force come in, and where are we placed in the decision making? Many meetings and discussion that the task force, myself, gets coordinated with current situation, current updates from CDC as well as the region, and working along with CEO Munya. And this is early response of the pandemic. From talking about test kits from Korea, making sure what fits and what is needed at the moment, and what has been recommended by CDC on our vulnerable level here in the CNMI to protect our people. So there's the time has been extended to past 1 year, and every day all the coordination that's been done are communicated through the health official, myself, GAR, up at Homeland Security and Finance. So the coordination does not just stop at one person. It gets vetted out. At one point, we were having weekly meetings with FEMA and DOD on needs to protect and enhance our health services. Discussions as far as building a parking lot because of health and safety of our people, making sure that our people have access to healthcare. That is one improvement that we made, the north parking, because we've utilized the existing parking for MCATs. For a couple months, MCATs were used for other purposes. At this time, it's being capitalized and maximized for vaccination. So, all this planning are falling into place in regards to what we're doing here and how we have planned out and provided the safety and care for our community. Thank you.
Thank you, Mr. Villa Gomez. And sure, Mr. Goro, if you would like to add something.
Yeah, I want to add that, with CEO here too, a lot of, I was reading through the questions, decision making and spending plan. We did, I think it was in April or May, convene and start a territorial action plan. We met every week at CHCC's conference room. We invited our federal partners there as well, FEMA and DOD support that we had at the time, and that had objectives of what we needed to do. I think three objectives we started with, and then went up to 6 or 7, to include things like the alternate care site, building more capacity at CHCC, NCATs, and moving forward, we've sort of put that on the back burner for now, because we completed a lot of the activities there. Now we have what we call a vaccination action plan that again drives all of our decisions and spending these days or as of late. So I think that answers a few questions that you had in that first section. If I could knock off one more here, the decision to build an ACS within a private hotel was one of the questions either you or your members posed. Early on in March, we got a alternate care site toolkit, which was put together by FEMA and HHS at the time, and the model they used was hotels. In fact, quite a few pages in there actually had, or was it Basin or something that was converted into a hospital. We use that model to guide us, not having large convention centers or other facilities. So we ended up having to do it at a hotel. Also, because we were sort of expecting a field hospital that came complete with the tents and the air conditioning and the lab and everything that a field hospital needed, but could not. We were at the bottom of the priority needs, I guess, at that time, but we still wanted to build and be prepared, so we did it at a hotel. Yeah. Thanks.
Thank you. So there was a 213 communication from CHCC that initiated the request for an ACS. Madam CEO.
Wasn't it, yeah, I think it wasn't a
It was a letter, and I think this was the start of our territory action plan. The 213, there's a lot of 213s associated after that towards that project, whether it was engineering, construction, or other materials needed, medical equipment, things like that. But there was a proposal from CHCC that had the alternate care site as one. It was a multi-pronged proposal to meet any shortfall we may have had. So one of them was MCAS, one of them was an alternate care site, one of them was just building within the hospital, some isolation rooms, and a few other items. We can share that.
And let's hear from CEO Munya, and we can move on to, I believe Vice Chair Staffler has some questions about the vaccination program, so we can move on to that next. Thank you.
So the territory action plan that Chairman and Gar were talking about, it's a discussion. In the initial part of the response was that we needed to sit down and basically come up with a plan to address the surge, build lab capacity, and also, of course, ensure that staff are protected with enough adequate PPE. So we came up with we started with 3 objectives, and then we kept expanding that. Not all of them were materialized. So I just wanted to clarify that as the health official, the role of the health official for public health in 63 is obviously there's a public health threat. Communication is given to the governor and the task force about, what can we do to address this to ensure that we contain any threat. And so that's when, of course, discussion on the territorial action plan and these things are being discussed, and we basically kind of like just pushed it back to the state to address those situations. So, but yeah, that's the communication that we have with the territorial action plan.
Thank you, Ms. Munya. I now recognize Vice Chair Staffler.
Thank you, and please forgive me, I've broken my device that had my questions on it, so I'm kind of going off of my memory as much as I can. But I guess I've been, paying attention in the news about vaccination rates across, or in the world, and what numbers people are looking at with respect to what they consider herd immunity, because then it can lead us to possibly opening up our economy. And I know that's something that we really want to do. We could be the first. So what is our plan with respect to what percentage of our population are we aiming for to be at that number, and what efforts are we doing? I mean, I know we're already pushing it, but really pushing it for that number. Thank you.
Actually, yeah, I'm gonna turn that over to the vaccination team.
The vaccination expert walked in and he can handle all of that. Of course, we're always going to be, I just want, before I said, we're always going to be limited by our allocation.
Yeah.
Sometimes we're told we're going to get this much, we don't get as much. Sometimes we're told we're going to get less and we get a little bit more. But it's everywhere, it's happening everywhere across the nation. Yeah, so Brodo can take on from there.
Okay, and Mr. Shibata, if you could also just state your position and for the record, your name and your position. Thank you.
Sure, happy to. Shubroto Banerjee, I'm the Chief Operations Officer for CHCC. And I also, a part of a team with CEO, provide operational support for our mass vaccination efforts, all 3 vaccines. So, Representative, with regard to your question on herd immunity, so the CEC standard for herd immunity is set at 80% of a community, and that's for adults only. So for us, that's 18 and above. And so we've been using the vaccines right now are only available for individuals. Most of them are 18 and above. Moderna is the only one that goes a little bit lower. So if you look at those numbers, we are on track to if we continue our pace to be able to get to most individuals sometime in the July time period. Currently, we're going very active in Arota and Tinian. And part of the challenge in being able to go more is, we've had very interesting conversations about, we've tried different things, going late, going weekends. We're understanding that the workforce is coming back, so we're extending our hours. But there are a couple ingredients that prevent us from going all out and being able to get it done in a couple months. It is the vaccine allocation that we and other states and territories are grappling with. We're also being very conservative in our administration of the doses that we do receive. We have adopted a rule where everyone who gets a dose 1 in CNMI is guaranteed a dose 2 in CNMI. Because for our plan from the CEO and others in the task force, ensuring both doses are taken gets to not only herd immunity, but gets to a protected community to really think about strategically opening up. We want that 95% vaccine efficacy in all our adults. The other is just space, really, human resources and space. We need, we can't grow nurses and pharmacists. We are maxed out at CNMI, at CHCC. We also have a hospital to run, so we can't burn out those individuals. We've gotten great support from the GAR and the task force with temporary staff that are helping out. Tremendous support from agencies, defense to name, DPS and other Ds who come in and help. So it really is a great effort, team effort. It just, there is a certain amount that we can vaccinate given the number of staffing. And it's mostly also, we can vaccinate a lot of people very quickly. The actual act of vaccination is very quick. We have to have space after the vaccination for observation. And so we're going through a plan right now and restructuring the MCAS tents that are at the CHCC and how we can utilize more of those tents for observation so that we can push the throughput higher. We're anticipating our numbers to go up given the mandate that the governor signed last week, and the numbers are increasing. And so we have to think ahead for the throughput that we hope will be coming over the next several weeks. I hope I answered your question. Thanks.
Yes, you did. You gave me the timeline was my follow-up question. But then again, that is all dependent on all of those other factors. And also our community being willing to come in and take the vaccine. And so I guess if anybody's listening out there, please go get vaccinated and support our efforts to open our economy. I yield, thank you.
Thank you, Vice Chair. Mr. Banerjee, since we are on this subject, I hadn't realized that we were only vaccinating adults until you said it. Given that the numbers that the chairman just cited, something like 10,000 people who have received their first and second dose, is that where we're at?
So about 8,000 have received.
About 8,000, okay.
Both doses.
So what percentage are we at now in terms of vaccinated adults in the Commonwealth?
So complete full vaccination, I would say we're about 20% of eligible adults. So utilizing 40,000 as the denominator of adults, 8,000 as the numerator, so 1 in 5.
Okay. Wow.
Yeah, it's not bad. It could be higher. We, again, we could do a lot of dose ones. But we run the risk of not being able to receive the dose 2 in time. And then we've lost that effort that we've invested in the dose 1. Oh, yeah. Oh, okay, sorry. So, we have with collaboration with private sector, Turnkey and others, to be able to put together a very robust information system that the data reporting, the data collection and administrative burden is huge for this one event. Other vaccine efforts that we do, normally influenza, vaccine for children's, it's nowhere near the level of data that's required. And so we are also expected to report to the feds through WebIZ every day. And so they're monitoring our use of our allocation based on the data that we send them for dose 1 and dose 2. There are jurisdictions that have utilized their dose 1 and then moved into their dose 2 allocation. And what that does is it triggers an alert on their end. And it does put them in, it does create a potential opportunity not being eligible for continued allocation. So the data that we're reporting and sticking to that conservative approach is keeping us within our plan that's been put forth and promulgated by HHS and CDC.
Thank you. Members, if I may, did you have other questions?
Did you want me to continue with this list of the ones that we did talk about?
Sure. I'm going to turn the floor over to Rep. Stapler to continue with the vaccination question.
I found the list. Thank you. And so we also were curious if you guys were able to provide us the vaccination numbers, possibly by precinct or even by age groups. I know PSS, for example, had gotten, an opportunity to come in at an earlier point. Do we know how many teachers have been vaccinated, et cetera? Thank you.
Yeah, if you want to list, we have a long list of from different departments because we use codes for the registration, just like we had given for the legislative members to use, where we could break it down that way. I talked to the company that helps us gather this data. We don't have it by precinct, but we could, if we wanted to. We just have to define what village belongs to what precinct if you were interested in knowing your precinct level. But we have it, currently we have it by village, and you actually go on a map and you can pinpoint where exactly you're from when you're registering for the vaccination. We do have it, the Manalco numbers were shared earlier in Chairman Gomez's slide that showed first responders, government employees. We can drill down if you.
Thank you. Maybe you can share that with us.
Yes.
Yeah, and I guess it's awesome to know that the data that you take from people can be used as a query to then look at who's been vaccinated. So that answers the next question I had. I guess one thing we were concerned is to how do we ensure equitable access to our vaccines?
Currently, we're working, we're following the phase planning on who's eligible for vaccination. As far as access, we've had recently some requests that an eligible Manalco, for example, doesn't have a right, and we tap on quota or look for other resources to get them to the vaccination site. But we are sticking to the phase plan on who's eligible for vaccination as of today. At some point, like you mentioned earlier, it might be the other way around where we're the ones out there trying to grab them and bring them in. But we do try to accommodate and homebound, for example, is CHCC, their team, I think they partner with private clinics or provider to go out to homebound, but they're doing it. Some of them are helping, but they're going out also and doing people that are just homebound, not able to come in. Corrections, they've gone into facilities to do vaccination over there too. So if they're eligible under the phase planning, then we try to reach them as best we can. And that's why I think we're not ready to move sometimes to the next phase, because we just want to make sure we're reaching everyone. And although 10,000 have been vaccinated, we do have a lot in queue also registered and waiting for their date in the next week or two.
Noted. And I guess one thing that's really, we'd like to maybe see what your vision is of what it looks like when we do open our economy up again. Like, what does that look like?
Well, that's a good question. As the meeting this morning with the economic advisors, and as well as the push of the private sectors and countries within our region, recognizing our CNMI as a safe destination. We want to continue on to promote, getting the vaccines to the arms of our people, as well as making sure that we collect every data that we need to collect and translate it to the equitable part of our vision and reopening our economy, as well as making sure that we continue on at the moment all the safety measures that needs to happen, because the vaccine is only doing one part, but we also have a part and as people to carry out. The vaccine would prevent you from severe hospitalization, getting into ventilators and other things, but you can also be a carrier of the infection. Thank you.
Madam Chair and Rep staff, I'd like to just quickly add to Chairman Wiggums, thank you. The question is profound, right? Like, what does true reopening of the economy actually entail? The truth is, here in the CNMI, because of the lack of kind of dictatorial restrictions, like as opposed to other states and territories, the economy has been essentially going. The problem, though, is that we haven't had a lot of the externalities needed to properly ensure that the domestic economy is properly supported, and that was exactly what was touched upon this morning by the Governor's Council of Economic Advisors. And I think right now we're having the government as a whole and as a Commonwealth, we're having to deal with this pivot of the success of the beautiful success of CHEC and the task force really coming in and essentially, by many accounts, creating one of the best public health responses within the country. But at the end of the day, our pivot towards ensuring that we can continue our economic viability by making sure that we can bring back our source markets, having them say yes to a lot of the protocols that we proposed to them, South Korea specifically, with the Ministry of Tourism, to ensure that they can say yes to us so we can actually reopen in that other dimension, so to speak. And also in being cognizant of our competitive island nations. We're competing with Guam, we're competing with Hawaii. They've adjusted their quarantine protocols as a result, because they also see the fact that their version of reopening entails that. For the Commonwealth, we got to give ourselves a hard look. And I think, again, harping back to what was talked about this morning, because it is very important, is that discussion of where do we go from here, and what is our definition of reopening? What should it look like? Because essentially, we're going to talk about it from a basic structure. Our economy has reopened. We haven't had Guam just reopened bars on February 24th, my birthday. On March 1st, they're going to be at Q3. Like it's going to be, and we're looking at it from that perspective. They're making that pivot, and we're competing with them on the same source markets. I think for us to have the cognizant approach that we are competing with them for those same tourists, how that entails to a true reopening of the economy. Thank you very much for that question.
Yes, please. Thank you, CEO.
Shibor and I have an itch to say something about that.
Beyond,
From the health
Can
perspective.
I clarify?
Yeah.
I was gonna first wish Kevin a happy birthday.
Oh.
Happy belated birthday.
That's right.
We
Happy
got that
birthday,
on the
Mr.
record.
Bautista.
Yeah, you know, I think that Shibor and I were looking at each other about this because, and I discussed this at a meeting today as well with the Pacific Island Health Officers Association, is that, we hope that, the health system, one of the reasons why we made the decisions to do what we did was because of the way our health system is structured, right? And we needed, we often talk about workers, our hospital. You're right, we compete against Guam, and we are not even close to what Guam has when it comes to the health system that they have, right? So we needed to be careful of that. So I believe in the economy. I think the economy needs to start thinking about health and putting decisions moving forward that they need to think about how health is, because it's really essential. And I think, I understand the situation about the protocols. I mean, you look at America and Samoa, they closed down, they shut down their borders. Not even, no one comes in and out. And that's because of their health system. And it's because of the health of the people too. One of our priorities in the vaccinations is to try to get to the vulnerable people, to get those people and get them the vaccine so that they can be safe, so that I can feel comfortable in saying, yeah, they can come in, people can come in, and if we get it, great, we're going to get it, but we're going to be 95% fighting it, and we're going to be alive when it's all over. And that's the key thing for, I hope that after COVID, health is not a second thought, an afterthought, that it's still a priority for the CMI. I mean, so I just wanted to add that in.
Thank you, CEO. So just to add to Kevin's comment, I think it has been a really strong data point that our businesses didn't completely close. Although we do see from CACC perspective, individuals who are, if we can find a positive out of something so chaotic, that the availability of presumptive Medicaid has allowed individuals to access healthcare that they never ever would have done before. So these are major opportunities for individuals to look at healthcare as routine and not only through the ER. Having said that, we have to understand and accept a few rate limiting steps. One is in the vaccine. While amazing progress has been made to create newer type vaccines, these vaccines right now prevent only from someone being infected to progressing to severe disease requiring ventilation and ICU level hospitalization. Hopefully the science will continue to expand to include ability for vaccination to address prevention of infection, but we're not there yet. And so why do I say this? It's how to balance that scientific data point with opening up and how to recognize that we still are vulnerable even if we get to herd immunity because of the even though we haven't had a community case in over 180 days, that we will not have the number of beds and workforce to be able to manage number of cases that could spread in the community. So we have to find that middle ground between a behavior change that is in line with economic change, that is rooted in core 3 Ws and is in some respect a modified quarantine process. What Kevin alluded to earlier about the success of the task force and CACC is really rooted in a very deliberate, scientific approach to quarantine for testing, quarantine, testing again. And that is something that may not necessarily have to continue in that complete level, but it's data, it's various data that we need. We need to have vaccination. We need to have knowledge of people coming in to the Commonwealth and their status. We need to know their symptomology. There is also the other challenge that 80% of cases in the mainland are among individuals who are asymptomatic. So our culture, whether it's here or in the mainland, is still very organized around someone coughing and having flu and being an emitter. And that's not the case with COVID. So we've got to try to figure out how to take these, leverage the success of these interventions, these prevention methods, and bring them into a business world that also continues to maintain these health structures. So I often say, instead of trying to fit the square into the circle, how do we fit the circle into the square? So it's not going to be perfect, but it's going to continue keeping the businesses open and expanding, but also keeping health in check and expanding as well. Thank you.
Thank you. I understand it's not that simple just to say we vaccinated everyone and now we can open. There's a lot of other moving parts that we have to consider. So I thank you guys so much for your focus on being data-driven decision makers, because our community safety is there because of those decisions. So thank you.
Thank you, Vice Chair. Are there any updates on plans to extend the vaccine to federal government employees at this point? Because they were in phase 1B and then they were not. But there are frontliners who are federal government employees, right? At the post office, the law enforcement, the airport. Will they be vaccinated?
So I think the I'm gonna take Yeah, so I think the long and short of this, we have, I don't have the data, but there are over 152, I think last count, federal employees that have been vaccinated. So it's not that we're not vaccinating federal employees. We vaccinated groups that are. I think the reason that we put not a pause was what we were informed by CDC. And we have been having continued conversations with them regarding what was at one point a dedicated allocation for federal employees. And so we have, there are federal employees who are long-term residents, and then there are federal employees who are coming here as temporary duty assignments. And so when we did our initial calculations, and that's what we use to review, all federal employees are eligible to apply, and that's always been there. Their applications are reviewed against looking at whether they are resident, long-term resident, short-term resident. We are moving forward with those individuals, and we're awaiting the update from CDC regarding the allocation for federal employees. DOD, in the beginning of the planning months ago, we were informed that DOD was going to take lead in ensuring all federal assets were vaccinated under their allocation. And so it just for CNMI, I think we've sort of, we're a rounding error, I guess, and they didn't really come back and factor us in. So we're continuing. So yeah, we have from the recent data, a little bit over 100, 190 federal employees that have been vaccinated. Sorry.
So I guess you know, so we were expecting an allocation for the third parties, and basically we haven't gotten it. And
Okay.
so we were told basically by CDC to hold off on the vaccination. And so, so that's what we're doing until we get the allocation. But you know, we've been monitoring the inventory and the amount of people that are registering, and also, as mentioned by FEMA and also by HHS, is that we needed to prioritize the Manamco. And so those are the concentration right now, is to try to make sure, try to get them, they're gonna be vaccinated. It's just, you know, right now at this point, you know, we're asking for everybody's patience, because there's a lot of people that want to get vaccinated, and we are not there yet. So until we get better allocations, then we can start, you know, basically move people that have been tended into this, to the front of the line.
Thank you. So, real quick on the subject of testing. So I think, Mr. Villagomez, you said that community-based testing has been suspended for now, correct? But what about testing for passengers who are departing from the scene line? Because I think we're seeing more and more residents flying off and traveling to other places. Are they able to access tests?
Yeah, so for testing for travel, you know, initially we were trying to figure out how to, for example, people are asking for testing for travel, and even if they don't need it. And so what it does is, as you know, CEO mentioned, is that we've had the presumptive eligibility, Medicaid, we're seeing a lot of people at the clinics. We just don't want it to be such an administrative burden for our, especially when our staff are busy taking care of and treating patients. So right now you don't need to be tested if you're traveling to Hawaii. We confirmed that with United. If you're traveling to Japan, I believe within 24 hours, if you're just transiting within 24 hours, they will not require you to be tested. The only one that requires the testing is Hawaii, and Hawaii is only for if you want to avoid quarantine. And that is a process which we have been accepted as a certified lab that can be accepted so that you can avoid quarantine when you stay in Hawaii. So it's available. We have the cheaper version for that does not require our lab, our nurses, and a lab, especially, you know, again, you know, you're cooking this lab specimen, so it takes hours to monitor this. So it's a cheaper version, which is the antigen testing, and that is acceptable if you're trying to travel to Japan, let's say, for example, and you're staying more than 24 hours, you would need an antigen testing. So that is like $57.
Okay, and it's the same for Hawaii, the one that Hawaii accepts?
Hawaii requires $300. That's it requires the lab to process.
Okay.
So that's a bit more pricey.
Wow. Okay. Members, did you have any other questions on? Yes, Magdalene.
Thank you, Chairwoman. Just one quick question. Has there been discussions in regards to starting the services to assist Manamco in terms of going back into the center and being able to?
That was discussed at one point with the director of aging, and from recollection of the meeting, the services, what I recall, was not suspended. They're just not coming to the center, but they're doing homebound visit, you know, coming up to their needs, as well as providing their necessary, you know, assistance that they usually get when they go to the aging center, and that's for the 3 islands, because there was a statement made, and you know, it was not not very clear, and we actually came out clarifying. But again, we're just basically waiting for them. It's an administrative process on their end to when to make that trigger, and we're standing by to provide them all the necessary guidelines. Thank you.
Thank you. Thank you, Jerome.
Thank you, Reverend Guanya. One question for, well, we'll start with our health official here, and perhaps the other two can chime in, Mr. Villagomez and Mr. Guerrero. So is the continuing state of emergency still necessary in your view? Do we still need to have these declarations renewed from month to month? The reprogramming authority to take from all different government agencies, is that still necessary when we are close to code green, it sounds like, or code blue, which is the code blue. We're now in code green, close to code blue. Vaccinations are ramping up. I mean, are we still in a state of emergency? Thank you.
I'll answer the public health emergency, according to the federal government, is still on, and in fact, that actually triggers the presumptive eligibility for Medicaid, and we did get a notice from HHS that it's extended all the way till the end of the year, and that they will only take it back for I guess if it's they're going to give us 2 months notice if it's going to be expired, and that's for the public health emergency.
So the end of, like, as in December 31st?
Yes.
Wow, thank you.
So for the state level, we do monthly assessment on the necessary action along with the guidance of the federal guidance. Yes, we still need to be in the emergency mode. There's a lot of coordination within intergovernment that are being pulled and coordinated to support from vaccination to safety, hearing community village-based enforcement. The AG is working as well with us, as well as the businesses and the public school systems that are coming back to more interaction in classrooms, and we're providing on-site evaluation as well as day-to-day guidance. Thank you.
I need it for reimbursement. If that executive order stops, then our costs are not going to be legible. But I think the short answer, and one answer maybe, is as long as there's a public health emergency, we're all in line to keep that going. But just as a side note, it's that executive order could also tailor to specific. Not everything has to be covered under month after month. I'll give you an example. In U2, we still had a contractor out there putting some poles in, so we had to keep an executive order active again for legibility of the activity. But it was sort of filtered and limited now to just that activity. So I think even with this, maybe later on we're going to see it sort of shrink, but there'll still be an executive order that needs to be in place for certain activities to continue.
Thank you for addressing that. And I think the last question on our list that has not been addressed yet is for Mr. Guerrero. Do you have any updates on the lost wages assistance program and the waiver that was requested from FEMA?
Sure. I was almost certain when CEO said the number $300 that it would trigger the $300 weekly payment that's available through the lost wages assistance. So on September 16 last year, we got approved for $7.7 million. So of course, it came with a 25% cost share. So if we paid out $300 for the first 3 weeks or 6 weeks, then the senior government would have to cover the $100 cost share. So for a total of $400 payment, that translates to over $2 million, as we mentioned last time. We have not paid. The latest communication was on January 6th, an official letter from Mr. Robert Fenton, Regional Administrator, FEMA Region 9, acknowledging the receipt of our September 10 letter. I actually wrote them requesting a waiver before we got the initial obligation that your request is being processed. You will be notified once a decision is made. So between September and January 6th, that's the only communication I got, even though after numerous requests for an update. And even as of this week, I'm asking for one last update. The reason being this program period of performance is going to end on March 27th. If we don't pay out anything by March 27th, then we forfeit this amount. So it's, I know you asked the question, has any other source of funding been looked at to match? We've been sort of hanging and hoping that we do get an approval, but with just 30 days to go, I think we have to, as a government, make a decision quick on whether or not we could source funding, and I will do that in the next few days to get kind of one final push. I know you asked that other states and territories, including our neighbors down south, have paid without that match or without a waiver. Guam asked for a waiver as well. They did get FEMA's go ahead and pay. I have to pay the share right then and there. I was asked if I wanted the same thing, but the fine print in there was at some point you still have to pay the share. So we never took it, hoping for a waiver. I know some poor payments and FPUC payments, although delayed, were still sort of coming out every now and then. If zero money at all is coming out, maybe we would have been more pressured a few months ago to make a firm decision then. But in my push in the coming days, if we are to make a decision, and if there's no other source of funding, then I guess I would ask FEMA for one last. If we pay this today, when and how much time are we going to get to pay the share, and that might be a factor in our decision to commit that to this program. The Department of Labor and the Secretary of Finance are aware. I don't know, can't speak for them if they've spent much time looking to provide cost share, but they're always following up with me as well.
Well, on that note, the Secretary of Finance was here in the chamber for a Ways and Means meeting, and we did inquire about the Last Wages Assistance Program. And if you could follow up with him, Mr. Guerrero, because he was under the impression that an $8 million match was required. So he said something in the ballpark of 7 to 8 million. And I recall that you had said it was lower than that. But also, we are expecting a windfall of federal funds that will be quite flexible and could be used for government operations. And he said it could also be used for the local match for LWA. So if time is of the essence, if we could possibly lose out on $7 to $8 million that could go right into the pockets of people who really needed it, last year, I would really, really urge you to reconsider not releasing those funds as soon as possible.
I agree, and I have given heads up to FEMA that should we decide in the next few days, there is an allowable extension of time to do it. So rather than lose out entirely, and I will report back to this committee next week, maybe along with the other reports on the status of that. To add to, I'm also exploring the same thing, the same my government got approved for, CDL, community disaster loan for U2. It doesn't have to be in millions and millions of dollars, but to cover some shortfalls in this event, in particular, the almost automatic $5 million that you could get could also be used for this and any other activity. And that I just have to wait a year though after the declaration for April 1st, but that's one of the options on the table too, and report back next week.
Thank you, we appreciate that. Members, we are coming up on our second hour. Thank you to our panelists for staying with us and answering all our questions. Are there any closing comments, closing questions before we excuse our panelists?
Thank you.
Yeah, just a quick one. I guess on behalf of the people of Rota, thank you for extending your consideration, especially to our traveling public. Trying to get our people home. I know that with the suspension of Storm Mariana's flight, it's a burden having to go to Saipan and then coming over to Rota. So with that, thank you, and so for also extending the vaccination to the public on Rota. And of course to the task force and CCC for all you've done in keeping our community safe. And so with that, again, thank you. And if there's anything you need from us, we'd be more than happy to assist. And so, thank you, Chairwoman.
Thank you, Representative Maglonia. Thank you, colleagues. And thank you again to our panelists. If I may say, I just compliment you all on the vaccination program. I just got my second dose a couple weeks ago, but it was so easy and efficient. Everybody was so nice and so professional. I got an email reminder, a phone call reminder, and I was just so impressed at how well managed it was. So kudos to all of you and your team. And thank you again for your time. If you have any closing comments, now would be the time. Otherwise, we can wrap up this part of our session and move on to the next part of our agenda.
Thank you, Rep. Sumlat, members of this body. Yes, we will be reaching out to this committee for assistance in the near future or inquiry, guidance, recommendations from you all as well as from the community. And thank you.
Thank you again, and for the operator also for a closing comment, because I wanted to point out and just looking left and right that who you see here sitting at the table, it's for us. I'm very grateful for CEO and COO for showing up today. It's the same thing when you see us out there. It's because we really work together every day, hand in hand, and the success is really because of that one team, one fight, they say. And in that, I wanted to also congratulate a couple of you for now being part of the task force, and look forward to your input and participation as we move forward. We don't meet often because this is kind of the task force out in the field, but when there's any updates, we would be more than happy to include you as well. So, and thank you for today. Thank you.
Thank you. Ms. Munoz, did you have any closing remarks?
No, thank you. I'm just always working with these guys. You can see how we work. Just if there's anything you'd like to answer, you can ask us later on too. And I just walked into their thunder. Thank you.
Thank you all very much. And members, let's take a quick 5-minute break, and then we can just wrap up. I do have a couple of announcements. Thank you. We are in recess. Yeah, let's get 2 minutes. Thank you very much. All right, and we are back to our meeting. It is now 3:35 p.m. At this point of the agenda we'd like to open for public comments. If there's anybody in the chamber who would like to offer public comments. There being none, we move now to our next order of business, which is discussion and announcements. Colleagues, I do have a couple of updates I wanted to share with the members. Some of you may have already co-sponsored the legislation that Representative Atta has drafted to remove the term limits for the Healthcare Professional Licensing Board. This was one of our agenda items for this committee, and so that I believe he has already pre-filed, but if you have not had a chance to sign and would like to do so, please do so. The legislation on the tobacco tax is just about ready, and I will be circulating that for your review in the coming days. And then we still have our Hope Recovery Tour scheduled for March 2nd. So we'll meet at the center at 9 a.m. in Markey on, is that Tuesday? Yes, on Tuesday. So that's still on. And then at our last meeting, we had discussed possibly scheduling our review of the medical referral programs, beginning the hearings anyway, on or about March 12th and the week after that. But I have since learned that I will have to take care of some family medical issues that will take me to Guam for exactly that week. And I wanted to ask for your indulgence in pushing that to the end of the month, possibly early April. But we can still begin the process of requesting information from medical referral, from the departments that are involved in the program, and get ready to have hearings, but not till the end of the month, if there are no objections to that.
No objections.
Okay. And then we do have bills and communications that have been referred to this committee, and I will start sending out requests for comments on those. And but for now, our next meeting was supposed to be scheduled for March 12th, and for now, I'd like to ask that we take that off the calendar since I will most likely be in quarantine during that time. So there are no objections to that. That's it for my announcements. Are there any other items that members want to discuss or raise at this time? Okay, there being none, let's entertain a motion to adjourn, please. Motion to adjourn has been made and seconded. All in favor, say aye. Aye. All opposed, say nay. We are now adjourned, and it is 3:38 p.m. Thank you, colleagues.
Good
job. Have a great day.
Thank you. You got those 3 minutes.
Good job, good job.
Thank you.